Hi, this is Eric Wilkie with the Emergency Center, and I'm going to talk to you about Zika virus. Now, the virus typically is transmitted through a bite of a mosquito, and that's the primary mode of infection. And this is mostly seen in Central and South America and parts of the Caribbean. But there's been some recent concern that it may be sexually transmitted as well. So this virus belongs to a family of viruses called the Flavivirus genus. It's a single-stranded RNA virus for those that are interested, and it's in the same group as West Nile dengue and yellow fever. Now, if you become infected with the Zika virus, only 1 in 5 people will actually have symptoms related to the infection. So most people will be exposed to the virus and never even know it. Now, if you're the 1 in 5 people that do develop symptoms, the symptoms that you will find is fever, rash, joint pain, conjunctivitis, which is the kind of the redness of the eyes, headache, and muscle aches. These symptoms are similar to other viral diseases such as dengue and chikungunya, although typically not as severe. Now, for treatment, it is mostly rest, hydration, and acetaminophen, which the trade name is Tylenol. And the CDC recommends that you avoid things like aspirin and non-steroidal anti-inflammatories. That would include things like Motrin. So if only 1 in 5 people get symptoms and the symptoms are not too dangerous, why all the excitement currently? Well, the concern right now is that women who become pregnant can have a birth defect called microcephaly. And this was brought to the attention when there was a Zika outbreak in Brazil and an increased incidence in microcephaly at the same time. So there is suspicion that these two are linked, but a firm causation between Zika virus and microcephaly has not been established. But there may have been other things that were happening in Brazil at the same time that may have led to this, a chemical exposure, although there is definitely a concern that Zika may be behind this. So what is microcephaly? Well, a child's skull grows based off of the brain growing. And if the brain does not grow, then you get this small skull, as you can see in this picture here. This is important because you can have intelligence developmental delays and other significant mental issues related to an underdeveloped brain. So this has a very big impact on the patients that it affects. Now, if you'd like to learn more, the CDC has some very good information. This is cdc.gov/Zika, and there's information for patients as well as clinicians there. Thank you for your time. This, again, is Eric Wilkie with the Emergency Center talking about Zika virus.